Hello out there. I'm Alex Knapp. I'm senior editor for science and healthcare at Forbes, and I'm speaking with Dr. Paul Offit. He's the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. Dr. Offit, thank you for coming on today.
Thanks for asking.
Yes. And Dr. Offit, we're going to be talking about the Advisory Committee on Immunization Practices, which met earlier this week. And before we really dive into it, though, for the benefit of our audience who may not be into the nitty-gritty of health policy, could you explain what the ACIP is and does?
Right. So the Advisory Committee for Immunization Practices, or ACIP, was created by Congress in 1964. So it's been around for more than 60 years. Here's the way it works. Typically, for example, if a company thinks that they have made a vaccine that is safe and effective, they submit it to the Food and Drug Administration. The FDA then will license or not license that product. If they license it, then it goes to the CDC, which has as its recommending body the ACIP. The ACIP then determines who should get it. So the FDA says you can sell it. The CDC says, after the advice of their advisory committee, who should get it. It's a recommending body.
Got it. And in terms of the history of the body, how seriously are the recommendations taken? Like, how do they impact, whether I have access to a particular vaccine, for example?
Right. So when the ACIP makes a recommendation, invariably insurance companies will then cover that vaccine. Also, there's something called the Vaccine for Children's Program, or VFC program, which pays for about 35 million children's vaccines. So once the ACIP recommends it, then the Vaccine for Children's program springs into effect and basically purchases vaccines for more than half the children in this country.
Mm-hmm. And then just in terms of finalizing those recommendations, I understand the CDC director kind of has the final word, can overrule what ACIP says. Is that correct?
Yeah, the ACIP is an advisory body. So they give advice. That advice can be ignored. There was an episode during the pandemic when they had made a recommendation, but the head of the CDC at the time, Rochelle Walensky, wanted to do something different and did. But for the most part, virtually 100% of the time, what the ACIP recommends, the CDC signs off on.
Got it. And I understand leading up to the meeting, in the past few weeks, there's been a lot of turnover in the body where Health and Human Services Secretary Robert F. Kennedy Jr. Basically fired all of the existing members of the body. 17 members, replaced them with 7 new members. Has that ever happened before, that kind of like drastic changeover?
Purge? No, it's never happened before.
So, and in terms of the new members, I think one thing that was significant to me is that most of them actually did not have any particular vaccine expertise necessarily, or even expertise in infectious disease or epidemiology. Is that unusual for there to be not lacking that particular expertise to be on this advisory committee?
So Robert F. Kennedy Jr. is an anti-vaccine activist, science denialist, and conspiracy theorist. The 17 people who were on that committee at the time that he came on to be Secretary of Health and Human Services had the kind of expertise we needed as the American public to get good advice, meaning they were experts in virology, immunology, vaccinology, public health. They were clinicians. Many had seen, for example, and taken care of children with vaccine-preventable diseases. Some actually were able to advise their own practice parents about, or they were able to advise parents about infectious diseases. But the problem with that, as far as RFK Jr. was concerned, is they gave advice based on science, based on good scientific studies. And that is an anathema to Robert F. Kennedy Jr., who's basically a science denialist. So for a completely bogus reason, he fired them all. He said they were deeply in the pocket of the pharmaceutical industry. They were just rubber stamps for the pharmaceutical industry, which was completely untrue. There was not a single conflict of interest among any of those people. No one had ever voted for something because they were deeply in the pocket of the pharmaceutical industry and were trying to enrich themselves. He couldn't name one person for whom that was true. There was a person in our hospital who was on that committee. It just came onto that committee. She had absolutely no conflict. So I don't know what he was talking about. What he was really talking about is he wants to put in there people who, like him, have an anti-vaccine bias. That's what he did. A couple of the people that are on that committee served as expert witnesses for him in lawsuits against pharmaceutical companies. There is a person on that committee who has lobbied against school vaccine requirements from state to state. No one really, with the exception of one person, Cody Meisner, had any sort of expertise in the areas that they're asked to give advice on. So I think the ACIP just took a giant step backward, and I think for the most part, the medical and scientific community is going to do their best to ignore them, because I think at this point they can only do harm, which I think is practically what we're in the midst of watching happen.
Yeah, and to that point, I know that the American Academy of Pediatrics just like would normally sit in an advisory capacity on the committee and refuse to sit down this time. Has do you expect more medical bodies to follow that lead?
Well, it's a very difficult decision because on the one hand, you want liaison representatives who can speak up and say, no, no, what you've just said is untrue. This is the truth. And that did happen a few times during the committee. But on the other hand, do you really want to be part of this clown show, which I think is only going to hurt the American public? I certainly understand how the American Academy of Pediatrics could reach that conclusion. But in some ways, I'm sad that their voice isn't around the table.
Yeah. And speaking of, the committee itself, were there any particular moments that stood out to you? We presented on a number of different topics, and I think there were a few things that I'm talking about the COVID vaccines in particular, where some of the questions that were being asked by members of the committee just seemed out of left field and completely baseless. And I'm curious what thoughts you might have on maybe the COVID vaccines in particular to start with.
Right. What worried me is that some of the committee members didn't understand how these studies were done, how one would do a study on COVID vaccines. And so that the CDC people tried their best to explain that. I think there were certainly misstatements about the COVID vaccine. So, for example, one of the voting members said that the protein that's made by that messenger RNA, can stay in the body for 700 days, which is completely false. It's really only a few days, and that's been clearly shown doing the right kinds of studies. There's a lot of bad studies out there that show that it's there much longer, but the studies that really truly do look at the spike protein don't show that at all. So this is what happens when you have anti-vaccine activists. The person actually who made that "it's there for 700 days" statement has also testified in front of Congress that the mRNA COVID vaccines cause cancer, heart disease, and autoimmune disease, which is completely untrue. This is the kind of advice that we're now getting from this committee. It's really hard to watch.
Yeah. And I'm curious, kind of historically speaking, we had in this meeting scientists from the CDC presenting the data that you're speaking about. And how rigorous is, I mean, I know you've got a knowledge, how rigorous are those studies? Like, how long does it take for those working groups to put together that data to present to the committee for them to ask questions of?
Right, sometimes months, but they do a superb job. And when you present before the committee, especially before a vote, you have the so-called ETR, evidence to a recommendation. So anything that you present is going to be reviewed by subject matter experts to make sure that the presentation is highly accurate, because when you vote, that has an enormous impact on whether you do or don't vote for a particular vaccine. And the lack of that when they brought one person up for a vote to present to the ACIP showed just how bad this can get. I mean, there was a woman named Lynn Redwood, who's been an anti-vaccine activist for 25 years, who got up and talked about thimerosal, this ethyl mercury-containing preservative that is in multi-dose vials that are given to adults, or at least some multi-dose. All multi-dose vials will contain a preservative, but there are many influenza vaccines that aren't given in multi-dose vials that don't require a preservative. But anyways, she got up there and proceeded to just misinform with sort of misrepresentations of studies, or pointing to a study at one point in her previous slides that didn't exist. She said something about the California public health folks saying one thing when they'd said exactly the opposite. So her slides obviously were never reviewed by subject matter experts. And she was the one, this anti-vaccine activist, that was presenting data on this ethyl mercury containing preservative vaccines that led to a vote of at least 5 of the 6 voting members voting against it. So that to me was the most egregious example of how this body is now being manipulated to serve as a forum for anti-vaccine activists and science denialists. And heaven help us.
Yeah. And I'd love to talk about that thimerosal vote because the committee did, as you mentioned, vote to not recommend any vaccines that contain this preservative. Can you talk first of all, like what that preservative does, like why it matters, and then what we know about the safety of that preservative?
Sure. So when you have a multi-dose vial, and you keep it in the refrigerator and you violate the rubber stopper again and again and again, it's possible you could have inadvertently introduced bacteria or fungi into that vial so that the person who gets the 8th, ninth, or 10th dose could then be inadvertently injected with bacteria or fungi, which can cause cellulitis, which is, say, a skin infection, or abscess, which is a collection of pus, or bloodstream infection, sepsis. So for that reason, really starting in the 1930s, thimerosal has been added to multi-dose vials and has safely then prevented all that. This came up, I was on the advisory committee for immunization practices between 1998 and 2003 when this came up, because as we were adding more and more vaccines to the schedule, you had the DTaP vaccine, you had the Haemophilus influenza B vaccine, the pneumococcus vaccine, the hepatitis B vaccine, many of which were contained in multi-dose vials that had this preservative. People were worried that it was too much mercury. Now, the thing is the mercury that is thimerosal is ethyl mercury. The mercury that's in the environment is methyl mercury. So assuming you live on this planet, and we've never met each other, but I'm going to assume you live on this planet, you are going to be exposed to methyl mercury all the time. It's in anything made from water. Therefore, it's in breast milk, it's in infant formula. We all have methyl mercury in our bloodstreams. So the question is, was ethyl mercury a significant contribution to the burden of what we already have with mercury anyway? And so there were studies done looking at children who got thimerosal containing vaccines, this ethyl mercury containing preservative, and found that that if you looked at their bloodstreams before or after getting those vaccines, it didn't increase because ethyl mercury is excreted from the body far more quickly than methyl mercury, so it doesn't accumulate. So it was really a trivial or arguably non-detectable contribution to what you already have mercury-wise. Nonetheless, there were studies done looking at children who received thimerosal-containing vaccines as compared to those who received the same vaccines that didn't contain thimerosal to see if there was any evidence for neurodevelopmentally poor outcomes, like autism. And study after study after study, about 9 studies at this point, have shown that there was no problem. So it was never harmful. So why bring this up? This basically resolved, settled issue. Why bring it up? And the reason is Robert F. Kennedy Jr. wants to scare people about vaccines. That's the goal. So when he talks about, well, we're doing this to maintain the trust in the public, it does exactly the opposite, and he knows that. He knows that because for 20 years, through groups like Children's Health Defense, he has been trying to scare the public to lose trust in vaccines. That's who he is. And I think we are going to suffer him. And the more that this goes on with this particular committee intact, we are going to suffer what is, I think, likely poor advice.
Got it. And I do know that, in a few months, this committee is going to meet again, and I think specifically to discuss COVID vaccines and others. And I'm curious, after the last couple of days, and as you're speaking to people in industry, whether it's the medical industry, or also the pharmaceutical industry, insurance companies, do you think that the healthcare system is still going to follow the advice of ACIP, or do you think that it may just make itself irrelevant?
I think that they won't follow their advice. And I'm encouraged by, for example, groups like the American Academy of Pediatrics has their own advisory committee. It's called the Committee of Infectious Diseases, or the Red Book Committee. And I know that people in the AAP, American Academy of Pediatrics, have been talking to insurance companies to make sure that if they make a recommendation, even if it's counter to the recommendation made by this sham ACIP, that the insurance companies would follow the AAP's recommendation. And they've generally been reassured about that. That's the good news. I think that what worries me is when the AAP advisory committees make decisions, they base it on data that the CDC presents. I mean, the CDC is the principal epidemiological body in this country. You count on them to do surveillance for diseases like COVID or RSV or influenza. And if you can't count on them because they're being perturbed by the Secretary of Health and Human Services, I think we're in trouble. I think what worried me the most was when a 13-year veteran at the CDC named Fiona Havers quit. So why did she quit? She quit because in April of this year, she presented data to the Advisory Committee for Immunization Practice when there still was an advisor, a real ACIP. She presented data to that group showing what was the impact of COVID on children this past year. And what she found was there were about 7,000 children hospitalized, that 1 in 5 of those children who were hospitalized ended up in the intensive care unit. Virtually all were unvaccinated, half were previously healthy, and 152 children died. She was making a case for the fact that we still need to have a primary recommendation for COVID for children. And what happened was days after she made that presentation, Robert F. Kennedy Jr. appeared on a 1-minute video with Marty Makary for FDA by his side, as well as Jay Bhattacharya from NIH by his side, and said, we are no longer recommending COVID vaccine for children, and we're no longer recommending COVID vaccine for pregnancy, when we're the only country in the world that doesn't consider pregnancy a high-risk group for COVID. So what he did was completely ignore her data, if he ever saw it. Unilaterally made a decision. This a man who said he was going to usher in a new era of transparency when he made this decision unilaterally. And she quit, and she said, and I think she gave an interview to the New York Times and on CNN, and said, I think that this administration is a danger to American children. I think that they are going to increase the risk of vaccine preventable diseases in American children because they just ignored all these data.
Got it. Well, it's certainly something that I think we all need to be keeping an eye on in the months to come, and especially when or if we get a CDC director, which is a position still unfilled at the moment. But in the meantime, Dr. Offit, I very much appreciate you coming on and sharing your expertise with us, and we will probably be in touch later on down the road.
Thank you.